Hello to all today. We will tell you about the problems that may occur in the urinary tract during pregnancy. So let's start. What are the symptoms of urinary tract infection during pregnancy? Urinary tract infection during pregnancy may occur due to changes in the urinary tract during pregnancy. Various infections can develop in women during pregnancy, and urinary tract infection is the most common infection. In order to take precautions against this problem, you should first define the problem and have information about its causes. By being aware of the symptoms of urinary tract infection, you can ensure that your pregnancy progresses in a healthier way. This information can also guide you in the process of contacting your doctor. Thus, you can follow the treatment process correctly. Urinary tract infection has been in almost every woman at least once. In pregnancy, due to various reasons, the presence of bacteria in the urinary tract proliferation and these bacteria cause changes in the urinary tract, resulting in some discomfort in the person. If urinary tract infections are not treated and progress further, they can lead to kidney infections. What are the symptoms of urinary tract infection during pregnancy? Some or all of the following symptoms may be seen in urinary tract infection during pregnancy: burning or pain during urination, frequent urination, mucus or blood in the urine inguinal pain, cramp-like discomfort in the groin area, pain during sexual intercourse, coitus, incontinence and inability to reach urine, foul urine odor, unpleasant odor that is different from usual and unpleasant, waking up at night with the urge to urinate and going to the toilet pain, pressure and cramp-like discomfort in the bladder area. In advanced cases of kidney infection, back pain, fever, chills, and sweating may also occur. If you have some or all of these symptoms, you can see a specialist for further tests. What are the types of urinary tract infection during pregnancy? Urinary tract infections can be listed as follows. Urethritis. It is an infection of the urethra, the tube that carries urine from the bladder to the outside of the body. Cystitis. Infection of the bladder is considered in this group. Pyelonephritis. Kidney inflammation. Infections that occur in the kidneys or upper urinary tract, in the structure ureter connecting the kidney to the bladder, are also considered in this group. Urinary tract infections are also divided into two as simple, complicated. These two different infections can be explained as follows. Simple urinary tract infections are infections that do not cause serious complaints and usually heal with outpatient antibiotic treatment. Complicated urinary tract infections, on the other hand, are infections in which serious complaints occur. The infection progresses, and outpatient treatment is not possible, and treatment is performed with hospitalization. How is urinary tract infection diagnosed during pregnancy? Symptoms and complaints seen in urinary tract infection are typical as mentioned above and can be diagnosed clinically. However, in every person, the symptoms are not visible but asymptomatic. At this point, urinalysis and culture are taken for the diagnosis of urinary tract infection in hospitals, and the diagnosis is easily made. What are the treatment methods for urinary tract infection during pregnancy? Vitamin C taken 250 to 500 milligrams daily, 25000 50000 IU. Daily beta carotene, 30 to 50 milligrams. Day zinc is effective in fighting infection. In cases of persistent urinary tract infection, urinary tract antiseptic and antibiotics are given. Urinary tract infection is treated with antibiotics during pregnancy. The choice of antibiotic is based on the gestational week and the degree of infection so as not to harm the baby. If antibiotics are used in treatment, attention should be paid to the time of use of the antibiotic. It should be administered on time and at the recommended dose. At the end of the treatment, urine culture should be taken again and repeated monthly. What are the factors causing urinary tract infection during pregnancy? Physiological changes caused by hormonal and mechanical factors and some behaviors may increase the risk of urinary tract infection during pregnancy. Some of these changes and factors can be listed as follows. During pregnancy, the bladder is prevented from emptying completely due to the growth of the uterus and the pressure on the bladder. As the bladder cannot empty completely, urine stays there and accumulates, urinary stasis, and causes bacteria to grow in the urine. This makes the pregnant woman an open target for urinary tract infections. A weak immune system or suppression of the immune system is also a cause of frequent urinary tract infections. The use of drugs that suppress the immune system may also pose a risk against infections. Diseases that suppress the immune system, autoimmune diseases, are also among the causative factors. Behaviors such as inadequate and incorrect urination and urinary retention are also among the factors that cause urinary tract infections. Inadequate hygiene after urination, incorrect rinsing and drying of that area from back to front are also among the factors that cause urinary tract infections. In the early stages of pregnancy, muscle tone decreases with the effect of progesterone hormone, causing the urinary tract muscles to relax. Thus, it causes the urine flow to slow down, causing the infection to increase. Various factors such as intestinal bacteria, especially E. coli bacteria, changes in vaginal flora, structural kidney disorders also cause urinary tract infection during pregnancy. What can be done to prevent urinary tract infection during pregnancy? There are some methods and things to be considered for the natural treatment of urinary tract infection during pregnancy and for the prevention of this condition. For the question of what is good for urinary tract infection during pregnancy, the details listed below can be examined. The most effective way to prevent urinary tract infection is to increase the amount of fluid consumed daily. At least 7 glasses of liquid should be consumed daily. It is especially important to avoid sugary liquids. Urine color should be light yellow during the day. You should also pay attention to your diet. You need to add vitamin C, carotene, zinc to your daily diet. You should reduce or eliminate the consumption of caffeine-containing drinks, alcohol, refined sugar, and ready-made fruit juices. Since the increased susceptibility to infection during pregnancy is related to your body's immune system, you can increase your body resistance by using multivitamins. You should empty the bladder at regular intervals. You should go to the toilet frequently. Do not wait until you get stuck and try to empty your urine completely. You should clean the genital area well after the toilet. Washing and drying should be done from front to back, and that area should not remain wet. You should avoid the use of harsh soaps and chemicals in cleaning the genital area. You should change your underwear frequently. Do not wear tight underwear and clothes, and prefer cotton underwear. You should take care not to stay wet in the bathroom for more than 30 minutes. You should go to the toilet before and after sexual intercourse, and if the infection is diagnosed, sexual intercourse is not recommended until the infection is treated and passed. Frequently asked questions about urinary tract infection during pregnancy. Can urinary tract infection in pregnancy harm the baby? If urinary tract infection is not treated, it can cause kidney infection. It can also cause low birth weight and premature birth for the baby. If urinary tract infection is treated, it does not harm the baby. Does urinary tract infection increase the risk of preterm birth? In pregnancy, if urinary tract infections are left untreated, they can cause kidney infections as well as problems affecting the baby, such as premature birth and abnormally low birth weight in the baby. What is good for urinary tract infection? Pain in pregnancy. In order to get rid of urinary tract infection and the pain and discomfort it causes, you should first contact your doctor. As a result of the interviews and examinations you make there, your treatment process progresses with the method suitable for you and you can regain your health. Thank you for watching.